Hi everyone. Today we will talk about obstructive sleep apnea. Obstructive sleep apnea is a sleep disorder that involves cessation or significant decrease in airflow. It is the most common type of sleep disordered breathing. It is characterized by recurrent episodes of upper airway collapse during sleep. Causes: it develops when there is a blockage of the airways. Air has to go from the nose through nasopharynx into laryngopharynx, through larynx, and then into the trachea. Somewhere along that path, there might be a blockage in the flow of air. Allergies cause swelling of the tissues in the nasopharynx, or there might be swollen adenoid glands or tonsils as a result of infection. Overweight: there might be too much weight in the soft tissue of the neck, which can weigh down the airway, especially when a person is lying down. Symptoms of obstructive sleep apnea include severe sleep deprivation, loud snoring, nocturnal choking or grasping, headaches, difficulty concentrating, fatigue, depression, and lastly, memory impairment. Obstructive sleep apnea is rarely fatal, but it can worsen other health problems. For example, drops in oxygen level, which can trigger inguinal chest pain and irritate heart cells, leading to arrhythmia, which is irregular heartbeat. Diagnosis of obstructive sleep apnea requires a Epworth Sleepiness Scale, sleep study to help identifying episodes of sleep apnea. The more episodes, the more severe sleep apnea. A sleep study usually involves monitored overnight with a polysomnogram, which tracks things like brain movement, oxygen and carbon dioxide levels, vital signs, snoring and movement. Treatment: weight loss for overweight or obese patients. Avoid sleeping pills, alcohol, and depressive medications. Sleep on side instead of back because it creates better airflow to the lungs. Continuous positive airway pressure device, which forces the airways open with a steady stream of pressurized air delivered through a plastic face mask. Surgical intervention. Sometimes obstructive sleep apnea can be managed surgically, for example, removing large adenoid tissue or realigning the jawbone.